approximately 135 million in grant funds are at risk because we are required for many of our grant programs to provide a matching source, and general fund dollars serves as that matching funds for the grant programs in order to draw down those grants, as well as cover costs that for services and programs that aren't covered by the grant funding. So we're putting at risk approximately $135.5 million of grant funding at risk. And many of the programs that you are referencing are mandated by the state that we're required to provide as the local public health department. And so we're putting not just the funding at risk, but compliance with the state requirements at risk as well, which increases potential risk and liability to the county overall. For example, our communicable disease programming. So for example, some of the work that we were able to do in our initial response to monkeypox, being able to respond to other communicable disease outbreaks within our community that put our children and families at risk would be substantially impacted. Our chronic disease and prevention programs. Harris County lags behind in the nation in many health indicators for chronic diseases. And so the lack of our ability to provide the services we're providing right now would be a major risk for us and the health and well-being of residents here in Harris County. We also provide our mosquito vector control programming, and that protects the public from mosquito-borne illnesses such as West Nile virus and St. Louis encephalitis, which are major diseases. And so not having the funding to continue those programs at their current level creates a substantial risk to the public that we're not going to be able to continue to mitigate the spread of those types of diseases. And then, of course, our veterinary public health program receives substantial general fund dollars for the operation of the shelter, our veterinarian services, our animal control. So we'll see more animals on the streets, as well as a reduction in the veterinarian services that we provide to the public, spaying, neutering, et cetera, as well as a reduction in our shelter operations, which quite frankly, at this current time, you all may recall, we've had record numbers of animals being surrendered to the shelter, and that would increase the risk of higher euthanasia rates of animals in our shelter. And then, of course, our work on public health preparedness. We are a crucial component of any disaster response, whether it's a hurricane, a flood, a fire, COVID. And so not having general fund dollars for those programs really impacts and hampers our ability to respond in a disaster. And then, of course, our ongoing COVID operations. We would not be able to continue to administer the COVID vaccine because we'd see a major reduction in the funding for those programs to fund the staff, et cetera. And so, as you mentioned, as Director Ramos mentioned, we're looking at a $10 million reduction in our public health programming.